Assalamu alaikum wa rahmatullahi wa barakatuh. Welcome to health program. In this program, we discuss a lot of health issues that concerning your health. We need you, as always, be healthy and be strong in health and in Iman. And may Allah subhanahu wa ta'ala give you and I the strength of Iman and the strength of the physical body. We talked to you previously about the spine. We are in this area of low back pain and neck pain. And the reason for that, because a lot of people, they have this problem. Most of the people, it's been studied that 85% of the population will have low back pain. And if we survey 100 people in one room, you will find at least 35 to 40% they have low back pain at any time. You and I are vulnerable to low back pain in a percent, like we have 70 to 80% chance to have low back pain. Before I continue, I will again warn you that this only for your information, this only to know about your back. If you have a real problem, if you have a back problem or neck problem, you should consult with your physician, your physical therapist, to get the proper advice, because every patient is different from the other patient. So this is my disclaimer on the screen. Read it. Please consult with your physician if you have problem. Last time we mentioned one of the problems. It used to be in the past that when we have low back pain, we get the advice, whether that from medical professionals or from family members or from community members, that you need to take rest and you stay without movement for a week or two and then come back again to and depend on medications and things, and that might affect your outcome. The outcome of low back pain depends on the early movement. Remember that. When you have the low back pain, if you stay still without movement for too long, the outcome will not be favorable. If you are moving early, you will get rid of your low back pain as early as possible. So movement, movement, movement. If you have low back pain, don't sleep or stay at home, that you need to do more walking or activity level. Again, consult with your physical therapist to see if that's appropriate for you. There is another point here that most of the people, when they get the low back pain, they get muscle pain or painkiller and muscle relaxants. And they said these are the best treatment, and they rest for too long, for 2 or 3 weeks on medications without movement at all. Yes, that the painkiller is needed. You need not to have pain. Take pain medication as needed and as directed by your physician, but also you need to move and exercises as early as possible. Don't stay still for too long on medication. Today I will talk to you about risk factors. What are the things that makes us, what are the risk factors that cause low back pain? One of the highest in the top level, all of you know that lifting heavy objects or light objects, lifting in improper way. And we will delay that to another session. We'll talk in details about lifting and how you lift objects. The second on the list is smoking. And we talked about smoking many times before. We talked about smoking with heart conditions, with diabetes, with high blood pressure, and we asked you to stop smoking. You are, as Muslims, you are the first one should stop smoking. I cannot imagine for a second that a Muslim and a smoker is compatible to each other. Should not be compatible at all. Because the Muslims, they follow the directions of Prophet Muhammad sallallahu alaihi wasallam. They listen to the Quran, and Allah subhanahu wa ta'ala want us not to put ourselves in danger. لا تلقوا بأيديكم إلى التهلكة. That do not put yourself in danger. And that is, if you smoke now, smoking is listed as the first cause of cancer, heart disease, and all other diseases. So if you listen to that and you still smoke, you are in great violation of your deen, of your religion, of your health, and of your economy. Why are you spending that money on smoking? Inshallah, I will hope that everybody will take positive action today and stop smoking. Actually, when I treat low back pain patients, and it is actually documented by research that those who are smoking are responding less than the non-smokers. If you treat 10 patients with low back pain, non-smokers versus 10 smokers, you will get good results. With the non-smokers, they will heal faster, they will cure faster than the smokers. So it's the second on level of the risk factors. The second on the list is the smoking. The third one is driving. Driving. With this time and day, we drive too much. We stay in the car for many hours, whether that because of the traffic or because of the long distance. And that driving itself, if you are not sitting properly, if you are not using precautions during driving, using your seat belt all the time and putting your back all the way on your chair, and you need some support on your back to support you while you're driving, proper distance of the steering wheel away from your body or close to your body. We will talk about that next few sessions. That is also risk factors for your back. The other one is the overweight. Then, of course, most of the people that they have increased weight, they complain of low back pain. And if you remember, a few sessions ago, we talked about the shock absorbing system. When you increase your weight, you increase the pressure, the compression on your disc. The disc is the area between the vertebral body. So you have a vertebral body on top of each other, and you have a disc in between. If your weight is increased, you are compressing it. You're increasing that compression, you are more vulnerable to low back problems. And then the following risk factor is your occupation, the type of work that you do. For each job, for each occupation, they have different risk factors. Some of the heavy lifting heavy objects, moving from one place to the other place, that may cause a problem. I saw patients that was working in the computer assembly line and standing, and then all the time is moving one place from one side to the other side, one place from one side to the other side. And I may ask the cameraman to follow me, because I'm going to stand up to show you that. So standing, if I stand up this way and I'm transferring from one side to the other side, then my job required that, to transfer from here to here. It's better not to twist your back, because twisting your back will hurt in the long run, but you need to hold it, move your leg, and put it to the other side. So you need to use your leg instead of your rotating or twisting your back. And that will save your back from getting hurt because of your occupation. Also, getting a job like sitting on the desk for all day, about 8 to 10 hours, this is another problem, and we will give you some tips how to sit properly for using the computer. What are the positions of the arm and the leg in the next session. And these are mainly the risk factors that may affect your back, and I will go a little bit review them so you remember that you talk to others about it. The one on the top is lifting improper way, that will cause they may injure your back. Second is smoking. Stop smoking. Again, are you listening? Stop smoking. Stop smoking. And then the second one, and that is the driving. If you drive, you need to drive sit in the proper positions. And if you drive for too long, more than 45 minutes, you need to stop, get out of the car, move around, and then continue. I know that some people in the traffic said that, wow, that's a big deal to get out of the car and walk around. I need you just to, if you stand up and walk for 1 minute or less than 1 minute, that would you relax your back and you will come back again to continue. The overweight, we talked about it. Control your food. Don't overeat. Overeating is not good. كُلُوا وَاشْرَبُوا وَلَا تُسْرِفُوا. Eat moderately. Allah subhanahu wa ta'ala give you all option, all food, alhamdulillah, to eat from it. But do not exceed your limit. So control that. So overeating. Occupation. There are some certain jobs have different risk factors than others. And we will, in general, we will give you some directions how to deal with that, but the specific job need to have a specific evaluation to protect yourself from danger. There are some other issues like pregnancy may affect your back, and it cause a lot of back problems, maybe twisting or standing in the kitchen for too long. These are other problems for the low back. We will talk about some more in the future and the coming sessions. Come and join us to know more about your back pain and how to prevent it, and if you have it, how you deal with it. Till this time, I need you to drink more water, be good in exercising, walking, and protecting your back. I'll see you next time. Wassalamu alaikum wa rahmatullahi wa barakatuh.
Assalamu alaikum. I am Ja'far Idris. You are watching Peace TV, the solution for humanity.
Marriage or divorce?
What's Islamic ruling?
Nikah.
Love book.
Solution or problem? Heaven or hell?
There is a misconception.
You choose. Beauty, wealth, family status, virtue. Decide what you want. Decide your choice. Be sad or be happy. It's your choice. Join Dr. Zakir Naik in Better Half or Bitter Half every Friday at 6:30 p.m. and repeat telecast at 9:30 a.m. India on Peace TV.
I am declaring jihad. And I am inviting all my brothers and sisters in Islam to join in that jihad. And I am inviting all my brothers and sisters in humanity to join me in that jihad. And I'm absolutely sure that every human being is engaged in jihad every day without realizing it. Saving this planet and the environment is a form of jihad.
Join Dr. Jamal Badawi in Peace and Justice next on Peace TV.
Assalamu alaikum wa rahmatullahi wa barakatuh. Welcome again to Health Issues. This is the program that you know more about your health, that you take care of your health, and that you talk to others about their health, and try to be all of us as healthy as possible, because Allah subhanahu wa ta'ala wants you to be stronger. Allah subhanahu wa ta'ala wants you to be a good fit. When you walk, move, stand, you need to be in a better position. That position that we will talk about it now, about the spine. We talked the last time about the back pain, neck pain, and how many of us are exposed or vulnerable to have this type of back problems. As I mentioned last time, before I will continue, I'd like you to know that this only to increase your information, to increase your awareness. If you have a specific problem of back problems or neck problems, you need to consult with your physician or your physical therapist. And this is sometimes because everyone is different. Do not take a prescription from somebody else that has low back pain. You have to be evaluated because everyone is different than the other, even though the symptoms might be the same. So, inshallah, if you have something, may Allah subhanahu wa ta'ala cure you, and consult with your physician, inshallah, or your physical therapist. Last time we talked briefly about the risk factors. What are the things that increase your vulnerability to have low back pain? We talked about driving, but was not the highest on the list. The first one was lifting. So if you lift in a proper way, you protect yourself from danger. Smoking. Did you stop yet? You need to stop smoking because that is, again, another factor. Actually, they said that the people that they have low back pain one time, they have 50% chance to have it again. And that 50% will increase if they are smokers. So if you are a smoker and you get low back pain, wow, good luck. You will have it again. And you will have it even worse if you have it next time. So stop smoking. Driving, we talked about driving. Overweight, don't eat too much. Occupation, evaluate your environment around you for your job. See what is the best mechanics, best way to move to protect your back. And there are some other problems that we will talk about it while we go. Now, today in this session, I will concentrate on the posture, especially with sitting posture. Most of us sit for too long, especially with those who have computer use, that they use the computer many hours, and they don't have the proper posture. If you look at the screen, in the middle of the screen, you will have that proper posture of the someone sitting. So you need to maintain the curves of your spine. If you set improper way, and we will show you some of that wrong postures, that will affect your back. You need your arm to be at about right angle, supported, and your leg is also about right angle at the hip and about right angle at the knee joint. If you bend forward while you're sitting on the writing and looking down this way, that it will affect your lower back. You need to sit up straight and push your back all the way on the chair. This sitting posture is very crucial. We have to take care of our back, because if you sit for 8-10 hours without taking care of that posture, that might affect your long run outcome if you have low back pain. Let me demonstrate that for you. I'll go back here a little bit and I'll show you exactly what I need you to do. Sitting on the chair, and then imagine that you're sitting on the chair on the computer, and you need to sit all the way back. If you can come the camera close to me so I can show exactly the side here. So on the right side, your shoulders should be a little bit rested on the back of the chair. The chair is better to have arm rests that's adjustable, that can be raised according to your arm level. So this chair, for example, is not good for me because I will lean on it this way or on the other way. So I need my arm to be lifted to relax your shoulder. See my shoulder here? If it's relaxed, it will take some tension off your muscles. But if it's not relaxed and dropped, that will cause a lot of pain. And a lot of people that using the computer, they will come straight and tell you, I have pain right in this muscle. And that's because of the arm support is not there. So we have the armrest, you have the back straight. Some people will need a pillow at the mid of the lumbar spine of the lower thoracic in this area right here to be behind their back, so they will get good posture, good curve of the lumbar spine. The hip has to be about 90 degrees, 90 degrees or 100 degrees fine, between your trunk and your leg. If you have short legs, you need to use some adjustment. So if you may need a stool to raise your leg on it, so you can support your leg and get to this function. If you raise your leg, and you need to maintain that 90 degrees. And also your knee need to be about that angle, about 90 degrees. Your foot should be rested and relaxed, not overstretched or not pinned. So you're not going that way or that way. So just in the mid position, in the resting position. If you practice that proper posture, that will maintain your good posture for good hours, and you can work for longer hours than the regular person that work for like 20 minutes or so and get tired. Now let me show you that one more thing. If you're sitting this way on your chair and you get tired and then you lean down, that is improper posture. You should not sit that way. That will put a lot of pressure on your back. There are some people also sit that way and put their legs. That's a good position here. Guess what? That's not a good position for your back. So if you are always sitting this way, please put your leg down, sit up straight, put your back behind, and support yourself, because this is better for your health. While we talking about posture, we need to look at how to use the computer. Depends on how much time I have in this session. I will go briefly on the position of the computer screen in front of you. We already talked about your sitting posture. So you're sitting straight. You have a right angle between your trunk and between your lower leg, and your knee about right angle. As shown in the screen, you will have that right angle between the hips and knees and between your trunk. The computer screen itself, your eyesight should be at the top level of the screen. The screen should not be higher than your eyesight or lower that much. It will be that. So when you are looking from your eye, you're going to the top of the screen, and you need to adjust either the table itself or your chair to get to that height. If you look at the picture, so here's the eyesight. So here's the screen. It's coming at this way, and it's coming in the top of the screen. So you're seeing that screen is close. Don't bend forward to close to the screen, and don't go too far away from the screen. You need to adjust your position to be in a good side for that. There's another problems with the computer users. They use the mouse, the use of the mouse. The best way now is to get a wireless mouse, not connected, so you have a freedom to move it around you. Do not keep it in one position. You need to change the position in different places. So do not put a lot of pressure on parts of your body. Because if you put your arm in this way for 8 hours, and I need you to experiment that with me. Can you raise your hand with me? Hold it, and hold it this way. How long can you maintain this position without even moving it? It will hurt. It will hurt your arm, of course. While we're using the mouse, we're doing the same thing. You're always holding your hand. You need to learn how to relax. So like that, you need to learn how to relax your hand on the mouse and then use it. When you use it, you move the mouse. When you are not using it, relax your arm, because this will reduce the risk from moving your hand, and the carpal tunnel and all the problems of the hand will be less if you moving your arm regularly. So again, using the mouse, different positions at different times. You don't use it at the same position. Your arm and elbow will be about right angle. Your shoulder. Arm rest is needed. You need an arm rest, so you support your arm, and your eyesight will be on the top of the screen. While you're using the computer, stop get up, move around every 20 minutes. Do not use the computer for hours and hours without stopping. You need to give yourself a break. You know, when you blink your eye, you need also you blink your body. So when you blink, that means that after working for 20 minutes or so, stand up, move around, get your muscles relaxed, go back again, and continue your work. We talked today about posture, how you sit on the desk to use the computer, and we will detail that, review that next time. Come join us next time. And we ask Allah subhanahu wa ta'ala to give us the right posture in this life and the right place in the Jannah, inshallah, all together. Increase your iman and increase your strength. Do exercise, increase your activity level, and we'll meet you, inshallah, next time. Assalamu alaikum wa rahmatullahi wa barakatuh.